The Argyle Sentinel Seal Chest Drainage Unit offers the clinician a simple-to-use chest drainage unit with improved methods for assessment and management of the chest drainage patient. Let's begin with the first segment, a review of the Sentinel Seal unit. The Sentinel Seal Chest Drainage Unit, like all other chest drainage units, is composed of the three basic chambers, plus an additional fourth chamber. The first chamber, the 2500 cc collection chamber, is accurately calibrated for both pediatric and adult use. The calibrations begin in half cc increments to 10 cc's. Notations can be made on the special white background. The second chamber, the underwater seal chamber, is calibrated at 1 and 2 centimeters of water. The 2 centimeter mark is highlighted in red as this is the generally accepted underwater seal level. The underwater seal chamber prevents air from returning to the patient and monitors the presence of a system air leak. The third chamber, the suction control chamber, is actually a built-in suction regulator. The suction regulator allows the prescribed negative pressure to be accurately and conveniently set. The fourth chamber, the patient assessment chamber, performs two functions. First, the patient assessment chamber monitors actual patient negative pressure. Second, the patient assessment chamber monitors the extent and progress of lung re-expansion. A built-in stand and metal hangers allow you to choose between standing the Sentinel Seal on the floor or hanging it from the bed. In addition, the Sentinel Seal incorporates several other convenient features. The negative pressure relief vent allows you to control increased negative pressure by simply depressing the vent. A red cap is attached to cover and protect the negative pressure relief vent. As the written instructions on top of the unit state, the negative pressure relief vent should be used only when the unit is connected to suction. Now, in segment 2, we will outline a step-by-step setup procedure of the Sentinel Seal. Directions for setup are printed on the front and top of the unit itself and on the instruction sheet inside the package. Remember, setup of the chest drainage unit should be completed to avoid contamination. The Sentinel Seal is designed for easy setup in any hospital situation. After removing the unit from the dust cover, open the outer wrap and pass the unit into the sterile field. Then open the inner wrap and proceed with setup. Remove the white packing trays. You may save the top, larger packing tray for use later as an irrigation tray. Extend the built-in legs and set the Sentinel Seal on a table. First, fill the underwater seal chamber to the red 2 centimeter line. Grasping the base of the suction regulator, twist and remove it from the top of the chest drainage unit. Now, fill the underwater seal chamber to the red 2 centimeter line. This will take approximately 90 cc's of water. Replace and twist the suction regulator base to lock it into position. Remove and discard the red protector ring from the suction regulator. Next, fill the patient assessment chamber to the red line. Remove and discard the white instruction tape from the top of the chest drainage unit. Now fill the patient assessment chamber to the red line. This will take approximately 30 cc's of water. To improve visibility, a small ball located at the bottom of the chamber colors the chamber fluid blue when filled. Next, connect the Sentinel Seal to the patient. An optional procedure for improved drainage and airflow is to crop the catheter connector and the thoracic catheter. The connections may be taped for security. If the physician prescribes gravity drainage, setup is complete. If the physician has ordered suction, connect the suction source tubing to the suction regulator stem. Set wall suction to 160 millimeters of mercury or higher. Set portable suction to 50 centimeters of water or higher. Next, turn the suction regulator until the fluid level in the patient assessment chamber rises to the prescribed setting. If the patient assessment chamber is tidling, the fluid level is rising and falling. The negative pressure may be determined by observing the high tidling level, say negative 22 centimeters of water, and the low tidling level, negative 18 centimeters of water. Then average these two levels for the negative pressure, in this case, negative 20 centimeters of water. To increase suction, turn the suction regulator clockwise. To decrease suction, press the negative pressure relief vent and turn the suction regulator counterclockwise. In this, the third segment, we will outline monitoring and assessment and management of chest drainage using the Sentinel Seal. Let's begin with the underwater seal chamber, which is monitored for the presence and amount of bubbling. Bubbling in the underwater seal chamber indicates a system air leak exists. The greater the amount of bubbling, the larger the air leak. Now let's discuss monitoring of the patient assessment chamber, which provides two indicators. First, the patient assessment chamber is monitored for tidling. Tidling is a direct indicator of the progress of lung re-expansion. The fluid should rise and fall with patient breathing. Two primary situations will cause an increase in tidling. They are any reduction in lung size, as in lung collapse or lung removal, and any decrease in lung compliance or stiff lungs. As a direct indicator of lung re-expansion, the greater the degree of tidling, the greater is the degree of lung collapse. As the patient improves and the lung re-expands, the amount of tidling will diminish. The patient assessment chamber is monitored second for actual patient negative pressure. The patient assessment chamber fluid level provides a direct, continuous reading of actual patient negative pressure. In review, observe the underwater seal chamber for bubbling, which monitors air leak. Observe the patient assessment chamber for tidling, which monitors patient lung re-expansion, and for actual patient negative pressure, which allows the prescribed negative pressure to be achieved in the patient. Finally, the fourth segment of this presentation will review the associated procedures with the Sentinel Seal unit. Some practitioners may wish to strip or milk the latex collection tube. The Sentinel Seal is supplied with a special milking sleeve, which makes this procedure neat and easy. To obtain a drainage sample from the Sentinel Seal chest drainage unit, form a loop in the latex collection tube. When fluid has accumulated in this loop, use a 20-gauge needle to puncture the latex collection tube and withdraw the fluid sample. After removal of the needle, the latex collection tube will reseal. To discontinue suction to the Sentinel Seal, which places the unit on gravity drainage, simply disconnect the suction tubing from the suction regulator. To conclude, the Sentinel Seal chest drainage unit is designed to provide the clinician with a simple method of accurate patient assessment. During autotransfusion, autologous blood from the mediastinal area or pleural cavity is collected so it can be re-administered to the patient. The advantages of using autologous blood are tremendous. When the patient's own blood is used, you prevent the transmission of diseases such as AIDS or hepatitis that may be found in banked blood. The possibility of a transfusion reaction is eliminated and blood compatibility is assured. The need for banked blood is decreased and hospital costs are reduced. The autotransfusion units are available pre-connected to Sentinel Seal or separately. If purchased separately, the autotransfusion unit must be secured to the chest drainage system. Just place the fingers of the autotransfusion accessory into the slats of the Sentinel Seal autotransfusion unit. The locking connectors on the tubes are all color-coded for easy identification. Disconnect the collection tube from the Sentinel Seal and connect the white connector on the collection tube to the white connector on top of the auto-transfusion unit. Now attach the blue connector on top of the Sentinel Seal to the blue connector on top of the auto-transfusion unit. Be sure that all connections are secure and all occlusive clamps must be open during collection of autologous blood. The Sentinel Seal unit should be set up as shown earlier. Once an adequate amount of blood has been collected in the auto-transfusion unit, you can choose gravity or continuous infusion. For gravity infusion, clamp the tube from the patient and disconnect the white and blue connectors. Reconnect the patient to the chest drainage unit and unclamp the patient tube. Then join the connectors on the bag. Now remove the bag to hang it on an IV pole. Since the autotransfusion bag is similar to a standard blood bag, optimal reinfusion is achieved. The bag can easily be placed into an infusion cuff and is funnel-shaped for complete drainage. If a pressure cuff is used, the maximum reinfusion pressure is 150 millimeters of mercury. For continuous infusion, an IV pump is used. The bag is simply spiked after priming the IV tubing set. Blood should not be reinfused below 50 cc's. Never reinfuse blood collected in the chest drainage unit. Anticoagulant may be added at the physician's discretion to the autotransfusion bag through the injection port. A microaggregate filter must be used for all reinfusion, and collected blood should not remain in the autotransfusion bag for more than 4 hours prior to reinfusion. The filter in the Sentinel Seal autotransfusion unit covers both the inlet and outlet ports, ensuring blood and fluid will automatically overflow into the chest drainage unit if clots occlude the filter. Please refer to all manufacturers' directions for use, warnings, and cautions for microemboli filters, IV blood administration sets, and blood-compatible infusion pumps prior to use with this blood recovery system to ensure functional compatibility of all components. Remember, disposal of all infectious waste should be per your hospital policy. As you have seen, the Sentinel Seal underwater chest drainage unit with autotransfusion is simple to set up, use, and monitor, but proper implementation is crucial, and in-service materials such as pocket cards, wall charts, and assessment management booklets are available. Thank you for your time today.